Live, sir.
Thank you.
This meeting is being recorded.
Good evening, everyone. On behalf of Indian Society of Organ Transplantation, I welcome you all for this ISOT EduConnect webinar on augmenting transplantation in Northeast India. Today we have special guest, Director Noto, Dr. Anil Kumar sir. Sir, we welcome you.
Thank you.
We have a speaker, Dr. Vivek Kute, who is going to talk on bridging gaps in transplantation, national perspective, and the way forward for Northeast India. We have eminent panelists with us, including Dr. Manjuri Sharma, Dr. Gulliver, Dr. Kangjam Shole, Dr. Manas Gope, Dr. Brojen Singh. We welcome you all. So, with this introduction, I request Dr. Vivek Kute to start his talk. So if you want, you can WhatsApp me. I will share from here.
Okay. Oh, the PPT is in the EduConnect group.
Okay, sir.
Can you make it to the full screen? Yes, thank you.
Okay. Sir, please go ahead.
Yeah. Thank you for the opportunity to talk in this webinar on increasing access to the transplantation in the Northeast states. ISOT was held in 2023 in Kolkata, and for increasing access to the transplantation, the one-day meeting was hosted by NOTO and ISOT with all the experts, nephrologists, transplant surgeons, administrators from Northeast states to discuss challenges and solutions for increasing access to the transplantation for starting the living and deceased donor transplant in Northeast. So proceedings of this NOTO discussion was published in Transplantation Direct journal recently. Next slide. Next slide. So this is the India map. The left panel is showing deceased donor organ transplant on the India map. The red shade indicate that deceased donor transplant is not initiated. In the Northeast, Assam and Manipur have started their deceased donor kidney transplant, and other states are planning to start their deceased donor kidney transplant. The right panel is showing access to the solid organ transplantation. So mainly in the Northeast, Assam, mainly the Guwahati and Manipur, they have started their transplant activity, and other states are making their infrastructure sufficient to start their transplant activity. Next slide. The left panel on India map is showing living donor kidney transplant. So living donor kidney transplant is established in the Assam and Manipur, and Mizoram has recently get permission for starting their transplant program. They have started their SOTO. Kidney Institute Ahmedabad is helping the state of Mizoram to start their transplant program in civil hospital Aizawl. The right panel is showing access to the living donor liver transplant. Unfortunately, there is living donor liver transplant activities yet to be started in the northeast states. Next slide. The left India map is showing access to the deceased donor kidney transplant, which is mainly in the Assam and Manipur. And right panel is showing deceased donor liver transplant. So deceased donor liver transplant is yet not initiated. Manipur and Assam has done only living donor transplant. Next panel. This is the India map showing all 5 rotos. The red shade is showing the northeast roto with all the states, and that is very emerging roto to increase the access to the transplant to overcome diversity. Next slide. So what are the challenges for transplant in northeast? Limited expertise, shortage of well-trained nephrologist, transplant surgeon, nepropathologist, support staff, and lack of monitoring and quality control. So majority of the states are having one nephrologist or one surgeon in entire state. To start the transplant program, we need 2 nephrologists and 2 surgeons as per the Organ Act to proper take caring of the transplant patients. So possible solution is telemedicine support, telemonitoring and online reporting. Regional training centers can be established in established states like Guwahati, Assam and Manipur. Local staff training in high volume centers, like all the transplant members from Northeast can get access to any of the public or private high volume centers. Kolkata is nearby. Even our hospital, Kidney Institute Ahmedabad, is willing to provide training for any transplant team members from the Northeast. Then collaboration from the society, Indian Society of Organ Transplant and Transplantation Society can give mentorship for training purpose. Then public-private partnership model can be implemented. For example, in certain states, the transplants are started in the private hospital, but they are not picked up in the public hospital to that great extent. So public-private hospital is also very useful resource from the local region. Then lack of immunological and tissue typing lab for timely cross-match study. Establishment of immunology lab in government hospital or regional lab. There could be one regional lab for entire Northeast. There is also already existing immunology lab in Guwahati. Then that lab can be accessed for providing immunology services to other centers. This is useful for elective living donor kidney transplant, but probably a virtual cross-match technique can be implemented in emergency situations like deceased donor organ transplant. Then limited availability of the immunosuppressive drugs and dialysis in all the districts. Then ensure immunosuppressive drug supply by the government schemes. Then sustainable dialysis care ecosystem and more support from Pradhan Mantri National Dialysis Program, especially to increase dialysis support in the remote area, so that patient need not need to travel along for getting access to the dialysis. Mobile dialysis units can be implemented or telemedicine can be facilitated to provide to overcome these challenges. Next slide. Then infrastructure limitations can be managed with the mobile dialysis unit. Start new transplant center, at least one transplant center per state, and that transplant center can be started and expanded, especially in the government hospital, so that they can increase transplant for the common man having financial limitations. Then financial constraints limiting paying capacity and higher equipment cost. NOTP provide funding for starting the SOTO, for starting the transplant program. So these funds can be utilized. Then public-private partnership. Then bulk purchasing of the consumable will save the cost. Then societies like ISOT, TTS, WHO can join hands with the SOTO, ROTO, and NOTO for providing help in all possible ways, especially with the help of expertise. Then limited community awareness and misconception about the organ donation. This can be overcome with the community engagement, social media, and IEC activity. Engage religious and community leaders, and NGO could facilitate counseling. Then patients and donor can work as an ambassador. Then up-to-date electronic communication, upgraded call center can be implemented. Regional language integration and training of existing telecallers. Integration with professional government grief counselor is very useful so that timely grief counseling can be initiated, and if especially for patients with GCS below 5, so that branded declaration can be performed as per the Organ Act. Then geographical challenges for organ retrieval and distribution. Establish a dedicated organ transport system. We already have existing NOTO transport system that can be integrated with the local SOTOs and ROTO Northeast. Initiate up-to-date transport. Drone and airlifting of the organ is possible way. Machine perfusion technology can be used to store the organs for a longer time, maybe up to 36 to 48 hours, and also to decide about utility of the organs. Then legal framework under the leadership of the Dr. Anil Kumar sir, Director NOTO. Majority of the Northeast states have formed their SOTOs. They are making preparation to start and expand access to living and deceased donor organ transplant. Next slide. So this is the summary of the paper published in Transplantation Direct. With the various discussion under the guidance of NOTO and transplant professionals from each state, Manipur did first deceased donor kidney transplant in August 2023. Assam did successful deceased donor kidney transplant in June 2023. Thereafter, additional deceased donations were carried out in the Assam and Manipur, and other states are getting ready to initiate their transplant activity. I am very hopeful that the state of Mizoram will start their living and deceased donor program in coming few weeks under guidance from all government support and NOTO. So to conclude, I will say that government support matter for increasing access to the organ transplantation. I will invite all of you to join the ISOT meeting Jaipur so that we can discuss various challenges and solutions for increasing access to the organ transplantation. Thank you.
Thank you, Dr. Vivek, for sharing the insightful talk. Now I request moderator, Dr. Saurabh Sharma, to please take it forward.
Thank you, sir. So, good evening, everyone. And I would like to welcome all the panelists for today's panel discussion. First of all, thank you, Dr. Anil Kumar, sir, for joining us today. Given NOTO's pivotal role in shaping India's transplant ecosystem, your insights are crucial. Sir, how does NOTO plan to support cadaveric transplant program in underrepresented zones like Northeast India? That is the question.
Yes. Actually, last year we have, because we believe that for having a successful cadaveric transplant, we need to have this, network which is present in other countries, other part of the country, that should also become functional in the Northeast region. And so that is one this thing that we are looking at. And we have sanctioned 4 SOTOs in last year in Northeast. These are the 4 new SOTOs like which have been sanctioned, and so that they push for this organ donation program, and so that is one thing that we look at. Currently, the ICMR is also doing drone studies for organ transportation. So, under the iDrone initiative, So we hope that initiative, if the studies they find it successful, it may help in organ transportation in certain difficult terrains of the northeast whenever donation is happening. Because that is also that currently we have most of these donations and the transplantation, they are limited to kidney only, and other donations are that other transplant and donation are very limited. So so that is one way of doing it, that this network should become active and functional in the northeast region also. So that is one big thing which we are looking at. Uh, so uh, because earlier we were looking at mentorship by the Guwahati Medical College, which is the Roto also, but in between there were Roto Guwahati was not functional. So there was some kind of a it was not progressing in the northeast. But I hope that 4 new SOTOs that have been sanctioned, like these states are Arunachal Pradesh, Tripura, Meghalaya, and Sikkim. So, and these 4 new SOTOs, they will be able to give impetus to the organ donation and transplantation in the northeast region. We are very hopeful of that. And and there is but definitely mentorship is required, and we have requested the Roto Guwahati also to give that mentorship, play that mentorship roles. I think IKDRC is also providing mentorship to some institution. Gangaram was also providing mentorship to one of the institution. We have RML Hospital, Delhi. They have deputed one doctor over there for mentorship of the, I think, the Meghalaya, this Arunachal Pradesh, SOTO, and for development of the program in Arunachal Pradesh. Recently, this nodal officer of the Arunachal Pradesh had visited Noto also, and we had guided him how they have to proceed. So, and we are ready to support them with infrastructure, but main problem is with the manpower availability and the particularly the surgeons. Perhaps they have the nephrologists, who are willing to serve in their parent state, but surgeons particularly they are not trained as per the transplant the qualification which is prescribed under the Transplant Act and rules. So that 3 years of training, that is somehow a limitation that they are facing. But that can be, like, we recently had a program meeting wherein it has been, in principle agreed that if 6 months of observership along with 25 cases of mentorship by a institute which is high volume of transplantation in kidney, can if the surgeon of any state from this region is posted for 6 months for observership, and then after that 25 cases the mentorship is provided by the mentee institute, that can perhaps take care of the training requirements also, and for the sake of development of the program, this can be accepted. This has been in principle accepted for implementation for development of the program in government institution as well as in such difficult areas as the Northeast is there. So, it was well recognized during the meeting also, that ISOT meeting, that there is a need. There is a need for, the need is well recognized. But how to develop these programs, that is also we have, these are some solutions that we look at to develop these active programs in the Northeast Eastern states.
Thank you, sir. That is an important policy level perspective. Support for underrepresented regions like Northeast is definitely the need of the hour. So the next question is for Manjuri Sharma ma'am from Assam. Ma'am, Assam has made remarkable strides recently. Could you walk us through the process and turning points that made the first cadaveric transplant possible at Assam?
Okay, thank you, Saurav. And yes, as far as the Northeast states are concerned, I think Assam is way ahead amongst other states. Not because that we are, overtrained or something, because we have good number of nephrologists. If I have to say about the number of nephrologists in the different states of Northeast India, you are all aware. So if I just said in Assam, there are about 35 nephrologists. In Manipur, around 15 to 20. In Arunachal, there is only one nephrologist, right? In Mizoram, there are two. In Nagaland, there is one. In Meghalaya, one. In Tripura, three. And in Sikkim, one. So because of lack of manpower, the other states have not been able to do transplants as required, number one. And number two is that there is a lot of lack of awareness. People are not very aware that we can do transplant over here. So you're asking me how we have gone ahead. The first transplant in Northeast India, that is in Assam, was held way back in 1989. Can you imagine? It was way back in 1989. But after that, there was a gap. We didn't have a permanent surgeon. Then the surgeon who was doing, he left. And then there was some problem over there. In between, some transplants were taking place. But since 2013, after the initiation of the DM program in my hospital, that is in Guwahati Medical College and Hospital, we are regularly doing transplant. And I'm also happy to say that we are also doing ABO incompatible transplant. We have done about the sixth number, I should say, ABO incompatible transplant last week. And then till now, we have done 3 disease organ donation transplant. So that is a big boon for all the CKD patients. As in other parts of the country, also the number of CKD patients are increasing day by day, even in Northeast India. And we have a long waiting list of patients waiting for kidney transplant, but who do not have kidney donors. So problem with us is that we are doing only a related transplant, right? So most of the patients who are wanting transplant, but then because of the nuclear family, they do not have any donor in the family. So they are going to the nearby state of West Bengal to getting the transplant done over there. Because of these patients going over to different states, the number of kidney transplant surgeries also little less is expected. So we are trying to do that. The government is very proactive. Our authority is also very proactive. And we are trying to convince more of our patients to do kidney transplants. So in this year, this in 2025, till now we have done 10 living donor transplant and 1 deceased donor transplantation.
Right, ma'am. Thank you very much. That is a milestone for the entire region. My next question is for Sholay Mehti, sir. Sir, JNIMS has made significant progress toward transplant preparedness. Could you elaborate how JNIMS is preparing surgical teams and ICU staff for brain death certification and organ retrieval? Sholay, sir.
Hello. Yeah. Good evening, everyone.
Yes.
Thank you, sir. JNIMS is a government-run medical college in the state of Manipur. So we have urology section in the Department of Surgery. So along with the urology and the surgical team, general surgery team, we have started this transplant program from 2022 June onwards. And so far we have done 65 kidney transplantation. And we have done 4 deceased kidney transplantation in our state. And in the map shown by Vivek sir, we saw that transplantation, disease donation kidney transplant happened in Manipur in August 2023. And in Assam, it is supposed to be, I think, December 2023, after Manipur. So Manipur.
Yes. It was on the 13th December 2020. The first transplant, yes, obviously was done in Manipur.
Yeah. So we have, for our state, we have this brain death certification committee comprising of the IC intensivists, the anesthesists, the neurosurgeons, and the neurologists of the state, including both the from the government and the private sector. And we have this, we don't have actually SOTO when we started the first deceased donation. So it was a little bit difficult to organize this. But Mohan Foundation played a very pivotal role in this regard. Sunil sir has, helped us immensely in starting this program. Even in the living donation also, the mentorship was given through this Mohan Foundation only. So it helped us immensely in our program. And way back before we start the living donation program, Mohan Foundation has helped in initiating disease organ donation program in the state of Manipur, collaborating with the government of Manipur. And they have done so many awareness program, community engagement programs, training and capacity building of the branded committee in the state, along with the ICU staffs. Then they also help in the development of policies related to organ donation in Manipur. And we have these ongoing activities going on. We have done so many workshops on strengthening organ donation in the state, along with the foundation. Police education program, police education training was done 2 years back, and then they help us in various ways. But from the state, we have asked for setting up the SOTO in the state, but I think it is not functional till now. They say that the Directorate Health Manipur said that the SOTO is there in the state, but I think it is not functional yet. So I request Anil sir also to look into this matter so that it will help us in streamlining the living donation and the deceased organ donation program in the state. Thank you.
Thank you very much, sir. Training ICU and surgical team is indeed foundational for a robust disease donor program. Very insightful, sir. So next question is for Gulliver, sir. Sir, it is commendable that a private institution like Shija Hospital took the lead in disease donor program in Northeast. Could you share what catalyzed this move and how the community responded? Gulliver, sir.
Thank you, Dr. Saurav. So after we did our first kidney transplant in August of 2016, the need for expanding the program was painfully obvious, and what was needed was donors, naturally. So when we did our internal exercises and homework, the way to go forward was ABO incompatible, then swapping, and a deceased donor organ transplantation. So we were trying to go ahead with the deceased organ transplantation, and we were actually at a loss for how to go forward. So we got in touch with Mohan Foundation. They were very pivotal, actually. So after getting in touch with them, their representatives came over. Dr. Shroff sir came over, as well as Madam Lalita Raghuraman, and we introduced them to the government sector. And we had various stakeholder meetings, especially we had one in January 2019, where there was a stakeholders meeting in which a roadmap was formed on how to go forward regarding deceased organ kidney transplantation. In that, it was decided to sensitize the government sector plus the public, as well as the police department and others. So as Dr. Sholay has rightfully said, there was a program among the police officers. In retrospect, it was very helpful because when we conducted the first deceased donor kidney transplantation, they were instrumental in clearing the roads so that the organ reached our hospital within 10 minutes of the retrieval. So that was how we went about. So this was the way we went about, and we have had various meetings. We have had various radio talks. We have had numerous television programs, as well as community outreach programs among the schools. These were organized by our hospital itself, as well as NGOs, especially Mohan Foundation. So the Mohan Foundation was pivotal in helping us go forward, in how to go forward, which we were unaware, but that is how we went ahead. And now we have a established deceased donor kidney transplantation. We have done 4 till now. So the organs were shared between the Jenims as well as Caesar hospitals, and most of the patients are doing well.
Thank you, sir. Indeed, community involvement is such a powerful driver, and that is a great example of hospital-led social outreach. So next question is for Brojan, sir. Sir, from an academic center like RIMS, how do you assess the transplant exposure in current undergraduate and postgraduate medical education in the region? Brojan, sir.
Audio is mute, seems.
Yeah, now you are, Brojan, sir, you are not audible. You are mute, sir. Now you have unmuted, sir. You can talk now, sir. Not audible, sir. Himanshuji, can you look into the matter?
Sir, they can rejoin, logging out and again rejoin. He joined in 2 names actually.
Okay. No problem. Meanwhile, we can proceed for question with Manas Gope, sir. Meanwhile, Brojan, sir, you can just rejoin. You can log out and rejoin, sir. Dr. Manas Gope, sir. Initiating transplant services in Tripura was not a small feat. And can you share some of the hurdles and how your team navigated them? Manas, sir.
Yeah. So actually, started. We did our first kidney transplant. Am I audible, sir?
Yes, sir. You are audible, sir.
Yes. So we did our kidney transplant in first kidney transplant in 2024, and we started under mentorship of Caesar Hospital, Manipur. They gave us technical skills resources. Gulliver sir is one of the pioneer nephrologists that helped us a lot. Dr. Somarendra from Caesar Hospital. Till now we did 3 transplant. Day before yesterday we did also 1 transplant in Agartala Government Medical College. And the government of Tripura has now tie up with some more like that within Mohan Foundation to start disease donation program. We have the biggest limitation that the infrastructure only for life-related kidney donation program. Now we need some inbuilt lab of CDC lab, then to estimation tacrolimus level, HLA lab. So government of Tripura from central funding had already sanctioned 10 crores. Now we have 3 urologists, 3 nephrologists. Now from surgeon point of view, they need some training, and we have in small state of Tripura the security prevalence and increasing, and we have a lot of cases. But biggest issue is that most of the people are unable to go outside state because of logistic issues. So we have enough donors, but problem is that the number of transplants should increase. So probably it will take time, but hopefully I am positive that in future we will do more transplant, and let's see.
Thank you, sir. Thank you for the insightful thoughts. Often the persistence is in the face of limited resources make all the difference. Next question again to Brojan, sir. Brojan, sir, can you speak? I think you would be audible now. So next question is for Brojan, sir. Sir, from academic center like RIMS, how do you assess the transplant exposure in current undergraduate and postgraduate medical education in the region? Himanshuji, can you look like Brojan sir is still not audible?
Yes, sir. 1
He has
minute,
rejoined
sir.
now. So
Yes.
I think. So I think next we can take Kute sir's question before Brojan sir. So next question is for Vivek Kute sir. So, sir, ISOT has been instrumental in capacity building and advocacy. From your national vantage point, we had love your thoughts on this, sir.
So definitely ISOT and all the members are committed to provide all sort of help to transplant professionals from the Northeast for training, for starting the immunology lab, for their nephrologists, for their surgeons. They can approach regional champions like our Arpita madam is from Kolkata, Manjuri madam is there, and Guwahati, Gulliver sir. So regional champions who are ISOT members and executive, they can help all the professionals for the training and capacity building.
Yeah, thank you very much, sir. Arpita ma'am is also here. Ma'am, can you share your thoughts? Good evening, ma'am.
It was nice to listen to the gradual, slow but consistent improvement of the whole Northeast, and the way NGOs, ISOT, and NOTO itself, under guidance of NOTO head Dr. Anil Kumar, had taken initiatives, and with all nephrologists enthusiastic and workaholic, the whole thing is progressing towards a positive corner. So I would request uh, the state heads like Manjari, like Dr. Brajen, Dr. Dole, Dr. Gullivar, all to suggest the best possible ways for their individual state, what type of advocacy they need. Is it uh, the nephrology training or the surgical support? What we may think of, that we can do this type of mentorship in a shared way from Kolkata also. In Kolkata also, we have a lot of transplant surgeons who may sit for and think of offering the support to the northeastern states. That way, I think Kolkata can help also. And from my side, I'm always committed, be president or not a president. My term will be over this year. I will be always there to join hand with my colleagues in Northeast.
Thank you, ma'am. Uh, Thank you for your insightful thoughts. So, next question again for Anil Kumar, sir. Sir, are there any national level plans for training transplant coordinators and ICU teams in Tier 2 and Tier 3 cities to boost the disease donor program in North states?
Actually, we in NOTO also organize these training programs. So, the hospitals which are doing transplant or organ retrieval, they are, welcome to send their professionals or the transplant coordinators for training. Because now when we organize the training that we have been giving, it is really making impact, and they are these coordinators who are trained from NOTO, because they are given field exposure also in good institutions like Army Hospital, R&R, or in AIMS Trauma Center, Delhi. And they, besides the theory lectures from by the eminent speakers, and within 5 days they become very, very well, acquainted with all the concepts of the organ donation, and they can, whenever they go back, they are able to, bring changes or bring, reforms for towards organ donation. So this suggestion by Dr. Madam Arpita Lahiri is very, valuable. If Calcutta can take a lead, if because the Guwahati is there, because I told you the Roto Guwahati remained non-functional in between somehow, because the Roto organization, so that they were supposed to mentor all the states of Northeast, and and initially they were traveling to all these states, and they, once the Roto had become functional, but because of some interference from some kind of allegations. The government of Assam, they halted the program. For few years, it was not functional. So that was a big setback for the program. Otherwise, it was going very well initially. So we can look for a mentor-mentee type of a initiative for taking up these programs. In particularly wherever there is a deficiency of surgeons and nephrologists, I think still also nephrologists in some of the states of the Northeast. And now the SOTO being there in some more states. So we hope that they can push for these active organ donation programs. And these states should be able to gradually build their own, systems, put in their system, because the doctors appear to be very dedicated. They appear to be very enthusiastic and dedicated, passionate towards the organ donation, and but surgical training is definitely required. A mentorship at their own institution whenever they are carrying out procedures, so that at the time of carrying out the procedure, that mentorship is very important. So we are ready to support in any way, whatever way is required. And the training also, like recently we conducted one cadaver retrieval training in collaboration with Amrita. This time we trained this Government Institute of Delhi, but we can take up the trainings of the retrieval surgeons from other Northeast states also. And we got a very good feedback also on that training, that they were all this multi-organ retrieval, which they learned during this 3 days, during this 1 day training. And they also got to do the hands-on also on the soft cadavers. So that is also very helpful. So we can help them in carrying out those trainings, and with support of the ISOT and the infrastructure, the network of NOTO, as well as the grants which are available under the program, they can very well, but definitely, and initiative is also there. So why they should not succeed? That is that I really, I'm very hopeful and optimistic that they will definitely succeed if everyone is, supportive. Even Guwahati Medical College can do that mentorship role for all the states which are not active.
Thank you very much, sir. As you rightly said, mentorship and infrastructure development, they indeed remain key to deceased donor kidney transplant program. My next question is again to Manjuri Sharma ma'am. Ma'am, as you look ahead, what are the challenges which are persistent and are affecting the sustainability and expansion of deceased donor kidney transplant program in the region?
I think we have to mobilize the patient and motivate. Not mobilize the patient, mobilize the people involved with the whole disease organ donation program, and motivation is very important. For that, actually, I had been organizing CMEs for the last 3 years, and each year I had been calling people from outside the state. First, I had Dr. Swarnalata with her team, with the anesthesia team. They had come over to the AMC, to my hospital, and then I have included all the departments who are actually involved in any type of transplant, be it our nephrology, urology, surgery, gastrosurgery, gastroenterology, cardiology, neurology, neurosurgery, and the intensivist, anesthesiology department. So that way our team was mobilized and we could do the transplant. Next, again, last year, there was another guest speaker from abroad, Dr. Lai of St. Elizabeth Hospital in Singapore. So he had actually come to our place, to Guwahati Medical College. Also, with him as an eminent speaker, I had organized another CME on disease organ donation, where again I tried to mobilize all the people of Guwahati, including the different hospitals, the private hospitals who are part of the ROTO, members of ROTO, and who are willing to, do the disease organ donation program. So I have included all those people, including the anesthesiologists, the required surgeons, the physicians, and also the counselors. The third CME that I held in my hospital was on the 13th of March this year, 2025. And this time I had invited Dr. Gopal Krishnan sir from Chennai. Sir had also come with his whole team, which is anesthesia department, which is emergency department. And then we had a very long discussion by the different departments of my hospital who are involved in kidney transplant surgery. So we need to actually mobilize the people of the ICU. What it happens, we are many a times we are being told that there is a probable deceased donor. So the moment we get the information, I just send my resident to see what is that probable deceased donor and how we can move ahead. And the first thing I asked him to do the blood group, and then we try to sort out the things. But eventually, the donor members, they do not want to donate the kidneys. So what we have to do, I think there should be lot of programs on disease organ donation. So in that respect, I have actually told the Roto director to hold meetings or some CMEs or some awareness programs wherever possible, so that we can motivate the people. The general mass, they should be aware that there is a program called disease organ donation, because if they don't come forward with their willingness to donate the organs of the dear ones who are in the ICU, who are brain dead, then I think this disease organ donation program won't be a success. We the doctors are very enthusiastic, very passionate, as like how Anil Kumar sir said. We always keep on waiting whether we get a good news that is a donor coming for us. But then ultimately there is a declination, or the people, they don't come forward to donate the organs.
Thank you, ma'am. Thank you for highlighting the common bottlenecks. So next question is again to Sholay sir. Sir, what a role has state government played in supporting infrastructure or manpower at JNIMS for transplant readiness?
So, in JNIMS, it was not under state government initially, but last 2 years, the JNIMS has come under the state government. So we have lots of infrastructure which needs to be improved, to give a state-of-the-art result in this institute. But I think we need lots of funding from the state government as well as the central government, so that we can have a good infrastructure setup, operation theater as well as in the ICU setup.
Oh, thank you, sir. Thank you for insightful talk. Next question for Gulliver, sir. Sir, what public-private collaboration do you think can help scale the transplantation in Northeast India?
Sir, I think one thing which we can do is collaboration and infrastructure sharing, which to go forward. Now, the private sector may not have everything. The government sector also may not have everything. But if we combine the facilities of both, I think that's a long way to go forward. I can think of one example, like our hospital, Caesar hospitals we have got the CDC cross match. So in the 4 deceased donor kidney transplantations which were done in our state, so that this facility was shared by both the government sector as well as the private sector. So the first 3 deceased organ donations were done in the government sector, that is JNIMS, and the 4th was done in the organ retrieval was done in our hospital, that is Caesar hospitals. So another point which we can think of is a collaboration with between the expertise of the private sector and the facilities of the government sector. As Dr. Manas, Dr. Gope has already highlighted, Caesar Hospitals has been actively collaborating with AGMC Agartala, and we have been mentoring the team for the past couple of years. So their team had come to us for training. We had gone to them to see whether the infrastructure was adequate. We had given suggestions, and subsequently we have done transplantations. Another which we have done before is in Arunachal. We had gone to the hospital, to the the government hospitals, and we have had an understanding with them that we will be more than willing to help them initiate the kidney transplantation. So this is, I think, how we can go forward. The problem is, sir, Manipur, as you know, we are having a problem with law and order. So we have had several transplants till now, as well as deceased kidney transplantations. So we have done 116 kidney transplantations. The last was done about 2 weeks back in our hospital. So we have had 4 deceased organ transplantations. Now the rates of transplantations have come down in our state simply because of lack of resources, because of lack of peace. In such conditions, sir, I think the government, the state as well as the center would be, I hope, willing to come forward and help us, the patients, especially with the loss of economic activity. The rates of transplants have come down because there's no money in the state actually. So I'm not very sure how whether this is a platform, really a good platform or not, but this is what is happening in our state. The numbers of transplants were enormous before 2023. We were doing at least 4 to 5 transplants in our hospital, at least. But after that, it has come down dramatically. The first deceased donor kidney transplantation was paradoxically done during the state of civil war, or rather, whatever way you may call it, but it was done because of the collaboration between the state and I mean state government and the private institute. So this is one point which I would like to put forward. But I think collaboration and infrastructure sharing between intrastate as well as between the states of the Northeast is one way where we can go forward to increase the number of deceased donor as well as live kidney transplantations in this underserved area of the country.
Thank you, sir. Indeed, the collaborative models will surely be the key in Northeast states. The next question to Manas Gope, sir. Sir, looking ahead on the similar note, is there a vision for regional collaboration or organ sharing network involving the neighboring states in the Northeast?
Yeah, actually, the first of all, before starting that, we have to at least start a basic infrastructure for the disease donation kidney program. So actually, recently the money has been sanctioned. So we need some upgradation for training of manpower. That said, we need a CDC lab, because you know that Tripura is in one of the isolated state. So if you want to pursue one kidney from here to other state also, we have to take some air ambulance. So there's a lot of logistic issues is there. So probably the there will be more signed with Mohan Foundation and Government of Tripura, and at present Government of Tripura Health Secretary is very much sincere to starting this disease donation program. So probably after this signing of more, we are going to start the infrastructure development followed by the disease donation program. Every plan has been sorted out, and probably it will take within probably 1 year. That's it. And this living kidney donation probably we are continue. The biggest issue is that infrastructure and manpower training. That's it.
Thank you, sir. That sounds promising. Now moving to Brojan, sir. Sir, is the issue sorted out? Are you audible now?
Am I audible now?
Yeah, yes, sir. You are audible.
Yeah.
So, sir, thank you for joining. So, our question was, do you think that undergraduate and postgraduate medical education in Northeast states includes sufficient transplant exposure?
Yeah, actually, our institute is under central government. We have around 4 nephrologists, but because of some issues, we are lagging behind our these 2 hospitals, Caesar Hospital and Jennings. The problem was because of transplant surgeon. We didn't have transplant surgeon, so we could not get this certificate or registration for transplant. Coming to your question, I think it's very much needed, and now as we are doing transplant, most of our undergraduate as well as PG postgraduate students, they are very happy and they are getting exposures. And now some point from my side to increase this living donor as well as disease donor transplant in our state. Right now also we don't have regular transplant surgeon. We have engaged one contract surgeon. That is one drawback. And as Dr. Guribar rightly said, sharing of infrastructure as well as manpower will definitely enhance the capacity for transplant in RIMS also, because in case of this disease donor, is we don't have in-house surgeon right now. we may take the help of this Dr. Somrendra and the Dr. Soleh from these two institutes to carry out the disease donor transplant. And some of the this another is this cost factor in the transplant. Though this cost in our setup is very less, as our peoples are very poor family, this all of the transplant which we have done till now, 90% is under card, this PMJ or CMST like that. And they are getting amount around 2.8 lakhs as a help for transplant. So I want to request Anin sir whether, I don't know whether this is a suitable platform for that or not, but if it is being increased to some 4 lakh like that, then lots of transplant can be carried out in our center as it is a government hospital. And this for getting disease donor, we have applied disease organ donation brain stem death certification from the state, and it is pending. So as the time progress, I hope that our institute also will be doing as per other institute or other center in the state.
Thank you for these ground level insights, sir. Next question to Kute, sir. Sir, what lessons from Gujarat's success can be practically replicated in Northeast, considering the resource and infrastructure constraints, sir?
Yeah. So many of you will be known only about the transplant activity of the Kidney Institute. But we have shown a successful use of telemedicine in Gujarat dialysis program. This is largest public sector dialysis network. We have more than 280 satellite units for maintenance dialysis in district and tribal area of the Gujarat, so that dialysis patient need not to travel more than 30 kilometers. The Gujarat dialysis program is run by Kidney Institute and funded by state government and Pradhan Mantri National Dialysis Program. It was inaugurated by Honorable Prime Minister so that we can avoid complications, morbidity and mortality by improving access to the dialysis. All dialysis are free in Gujarat dialysis program, irrespective of any economy. No document is required. Any dialysis patient can walk through. He will get free dialysis in Gujarat dialysis program. And government of Gujarat and PMNDP provide us 2,200 rupees per dialysis to Kidney Institute for managing the logistics. This is a single-use dialysis, and all the test and erythropoietin is also free. So I have seen that there is a increasing number of dialysis centers in the northeast states, but most importantly, all these 280 satellite units are managed by us by telemedicine. So this is the key message, that with the help of telemedicine in Digital Bharat, we can get better healthcare delivery in the remote area also. Second point is that so far we have done 8,000 kidney transplant, around 1,000 liver transplant, around 25 pancreas transplant. 95% of these transplants are free under state government schemes or central government schemes. Now the Ayushman Bharat is providing free transplant, free immunosuppression, free pre-transplant evaluation. So there should be one center of excellence in each state, so that common man can get free dialysis and free transplant in Northeast. And I think the local champions, local is vocal. They are ready. They have shown that local champions can help. Public-private partnership will also help. so that we can increase access to the transplant with the teamwork. Thank you.
Thank you, sir. So we have concluded our panel discussion. So back to Anil Kumar, sir. Sir, any final thoughts from your side? Yes, sir.
Actually, in Northeast, some of the government institutions are also very developed, like Guwahati Medical College, NIGRIMS in particular, and RIMS Imphal, and GENIMS. So these government institutions, they can make target-based approach that they will have to, and they can easily, if they are lacking in infrastructure, they can easily seek funds from the NOTO, because usually the NOTO will give funds to the government institutions only, and definitely public-private partnership also will help. But but to have it, because they have to cover all the difficult terrains and all the areas and all the states. So government institutions should also take initiatives to foster these programs, to develop these programs in their institution. And the institutions have lot of infrastructure in supporting departments, in other departments, which they can use, like NIGRIMS is a big institute, so they can easily develop such programs. Manpower is a issue, training of manpower, that these challenges are there, and definitely they have to work it out through collaborative efforts, and relaxation of rules we can support, particularly for northeastern states. Yes.
Thank you, sir. The policy perspectives from NOTO is invaluable and given us a clear view of national roadmap, sir. Today, sir, any final thoughts? Manjuri ma'am, any final thoughts?
Yes, Manjuri madam, Arpita madam have trained so many students which are working in the Northeast, and I think their teamwork will lead for increasing access to the transplant. Thank you.
Yes.
Yeah, I'm also very happy to share that Dr. Manas Gope was my student. So after passing on from my institute, he has gone back to a state. And at the time of their leaving my institute, I always tell them, go and you develop nephrology in your own state. So he is doing very good. This way we can increase the number of nephrologists, whereby we can increase the number of transplants in our locality.
Yeah, I can see Oik is also online. She's the first nephrologist in Arunachal Pradesh, the only nephrologist, and trained under the madam.
Yeah, and she was also my student. So it's nice. These students are going back to the states and developing. Even in Meghalaya, Dr. Inda Kyulin, she is also from my institute only. She passed out from my institute. So I am also pressing her that she should develop nephrology in her own state.
Thank you, sir. Thank you, ma'am. So on behalf of ISOT EduConnect, I extend my heartfelt thanks to all our esteemed panelists for sharing such an insightful and living experiences and practical solutions for augmenting disease donor kidney transplant program in Northeast. Thank you very much.
Thank you.
Thank you.
Thank you, sir.
It was a pleasure.
Thank you, ma'am. Thank you, sir.
सर बंद कर दो सर, मनीष सर।
अभी तो YouTube पे लाइव नहीं है ना?
है ना सर YouTube पे लाइव?
हाँ, तो रिकॉर्डिंग बंद हो गया ना अभी?
नहीं, हाँ रिकॉर्डिंग बंद हो गया ना।
ठीक। विवेक सर, एक मीटिंग कर लेते हैं। मैं आपको
Yes. Okay. We will rejoin.
Yes.
मैं रहूँ कि मैं लीव कर दूं सर?
हाँ, तुम ये YouTube पे बंद कर दो, फिर तुम चले जाओ।
एक सेकंड, YouTube स्टॉप कर दे।